Friends, family, and colleagues, I am so humbled to greet you as your 2021 GOA President. As we emerge from our pandemic cocoons of 2020, we have much to be thankful for, as well as much to look forward to in 2021. The year 2020 certainly did not turn out as we had envisioned it. In our minds, 2020 was supposed to be the year of the optometrist, foretold by the Gregorian calendar since the year 1582. How thick is the irony in that? It turned out, for many of us, to be the hardest and least enjoyable year of our careers. We faced closures, financial hardship and lost revenue, staffing issues, ever-changing regulations, and more stress than ever before. But, like the lowly caterpillar that emerges the beautiful butterfly, we as a profession have emerged post-pandemic as better businessmen and women. We have grown in our wisdom as healthcare providers, more compassionate towards our fellow man, and in Georgia, stronger as a profession and an association. I would like to thank our GOA board that expanded hours of online CE during the pandemic. I'm also grateful for our Board of Trustees that sacrificed time from their families and their professional lives to collaborate and guide our association as we navigated unusually difficult times. And I am grateful to our GOA staff who fight tirelessly on all fronts and truly love our profession. And lastly, I am amazed at how relentlessly our president, Dr. Jeannie Perrine, worked on our behalf to direct, connect, and build up our Georgia optometrists during such a difficult time. Her unwavering dedication to our profession was on full display. She relentlessly pursued our best interests over the past year, and I'm thankful. Since our last live gathering, the challenges of the pandemic saw the GOA respond in dramatic fashion in their support of Georgia ODs. Here are just a few of the highlights. Georgia ODs were deemed essential healthcare workers by Governor Kemp. Georgia sponsored webinars regarding ongoing updates to clinical guidelines during the evolving pandemic. We held our first ever fully virtual fall GOA conference. We coordinated 13 hours of free online CE with our Diamond sponsors. We defeated legislation that would have taken away our definition of what constitutes an eye exam. We introduced and promoted our own legislation that would mandate that we are never required to discount services that are not covered under a vision plan. And so much more was accomplished. All of this was accomplished as a team under less than ideal circumstances. So where do we go from here? As we look forward to a post-pandemic world in 2021, I want to preserve, promote, and advance Georgia optometry. This will be my mantra this year and the guide by which I hope the association moves forward. What does that look like? It means that we return to live from Atlanta, it's GOA, Saturday Night Live style, and bust out of our cocoons. We need to have local district meetings, presidential visits, and relaunch programs that were paused, like GOA Leadership Academy, Young OD Network, Corporate Committee, Mentor Program, live meetings, and so much more. This is the year of, in the immortal words of the Blues Brothers, we're getting the band back together. We're on a mission. Or in our case, seeing our membership in person again. There will certainly be challenges to face, but time and again, we have shown the courage, dedication, and resilience to respond to any and all of them. Our strong association has guaranteed that Georgia optometry will always have a seat at the table of ever-evolving healthcare. With your continued support through membership, personal advocacy, and PAC support, I hope to continue to build upon our successes. Preservation. We must preserve how far we have come as a legislative profession. Make no mistake, without our association watching our back and the advocacy of Dr. Whitlow, Mr. Aubrey Valines, and Brian Markowitz, our livelihoods can be taken away with the stroke of a zealot pen. We have and will continue to face many attacks that try to erode our standard of care. One example, and our most pressing threat, as well as opportunity, is telemedicine. We must be proactive to define what exactly this means to our profession and our patients. We, the doctors, must define what is and is not acceptable care in an online setting. We must be careful to not let outside parties with financial interests erode our quality of care or the definition of what constitutes a comprehensive eye health and vision examination. Another example on another front this year is how we successfully passed legislation just signed into law yesterday by Governor Kemp, blocking vision plans from dictating discounts on non-covered services. However, make no mistake, those same plans will be back, continuously looking out for their financial interests at the expense of Georgia optometrists and their patients. Additionally, there will be battles with e-commerce in our future as well. As your president, I will be vigilant to preserve the hard-fought victories of our progress. What about promotion? I will promote our profession. There is no reason that optometry is not recognized as the gatekeeper of primary eye care. Did you know that 85% of primary eye care visits are with an optometrist? The days when ODs were viewed as refractionists are long gone. We not only care for the precious gift of sight, but we also diagnose, treat, manage, and coordinate the care of complex medical and health issues on a daily basis. We should be serving our patients with the full armamentarium of skills, including the hard-won right to use injectable medications. As ODs, we are held equally to the same legal standard as all other medical doctors. It's time that we own our space and then promote it. When Georgians think of eye care, you, their optometrist, should spring to the mind as the definitive starting point for eye health and vision care. What about advancement? Lastly, I will passionately fight on our behalf to advance and elevate our profession on all fronts. While the uninitiated think we should move aside, stagnate, or even acquiesce privileges previously granted, I think not. We must ask ourselves, if not us, then who? Who will fill the void by our apathy? Who will stand in the gap for our patients? Who will own our space in the healthcare arena? We should never abandon our roots as the experts of the visual system, but our training also encompasses much more and encompasses the treatment and management of conditions that affect the eye and the ocular adnexa, stopping short of intraocular surgery. But the question is, does our clinical practice reflect our training? Do you fully use your licensure to serve your patients? Unfortunately, many of us do not. The wise bard of public knowledge, Wikipedia, barely even mentions, almost as an afterthought, that optometrists are qualified in the treatment of eye diseases. We, as a profession, must use our training and licensure to the fullest extent for the betterment of our patients. Only then will we move the needle of public perception. Our GOA protects our right to practice at the utmost of our training. When we stop moving forward, we will lose traction and begin to actually move backwards. We outnumber ophthalmology 4-1, and oftentimes in rural areas even more. And our patients need our services. Should this possibly include YAG lasers or Botox injections? We have evidence from some states that say yes to both. With these goals in mind, I would ask for your support as we emerge from our pandemic cocoon and with a renewed passion for our craft and dedication to our family of patients. How? How do we do this? With your membership, it is the cheapest practice insurance you can have. With your time, be active, volunteer, advocate. With your money, contribute to our PAC. Support your local legislator financially, with free eye care or a friendly lunch, and explain to them what exactly we do. And finally, with our voice. Collectively, we are stronger than we will ever be alone or in fractionated groups. Though we may take different professional paths, we need one vision that we passionately pursue to preserve, promote, and advance optometry. So, as I begin my journey as president, I reflect. I would have never pictured, nor was it my goal as a struggling second-year student, that I would be leading the charge in my state. However, a champion for optometry, former AOA president and my mentor, the late Dr. Rear Admiral David Solon, said to me, "Doc, this profession will be good to you if you are good to it. You will owe optometry something for the life that it affords you and back to the patients that you serve." He was a great man, he was a friend, and a giant of optometry, and I will be forever grateful for his mentorship. Likewise, many of you here and watching have mentored and inspired me to give back to optometry. I have had the honor to know personally and serve alongside many gifted and genuine colleagues. If you are one of those, I thank you for your influence over my career and know that I hold you in the highest esteem. If you have agreed to serve as a board member or executive committee member, I thank you and look forward to working together with you. Of course, I could never stand before you without the foundational love of my parents, my 4 amazing kids who I'm blessed to be called their dad, and my anchor, my love, Kelly, for her enduring and unwavering support of all that I do. Though at times I am more comfortable in a support role, the lesson I learn or recall from Ecclesiastes 3:1 comes to mind. For everything there is a season, a time to be quiet and a time to speak. With your support, I plan to honor Dr. Solon's sage advice to the best of my ability. So, it is with gratitude and humility that I accept the office of President of your GOA. Let's emerge from our pandemic cocoons and celebrate our victories. Let's move forward, just as we have in the past, unified as one to preserve, promote, and advance optometry in the great state of Georgia. Thank you. God bless.